guys. Happy Wednesday afternoon. It's hot. So what I'm going to do is I'm going to take everybody through the inside on a tour, kind of show you what we have that's new, what we have that's the same. Everything's still kind of a work in progress, so not everything is as neat and tidy as we'd like it to be, but I think you'll enjoy it. So. All right, so starting off in the lobby, and one of the things that I talked to the architect about was just a big open and airy space. One of the things that you'll remember about our last building, which we love, but there wasn't a ton of open space and not a lot of natural light. So that was really a focus when we were building this one. There was a guy in Georgia that designed it. He's been very specific, so super excited to work with him. And so we have the front reception counter, and same kind of thing applies. Right now we're still checking out in the rooms until we get most of our furniture. You can look down here and notice that there is no seating, and so that's COVID related, so we're super pumped about that, but it doesn't always go as planned every time, especially with construction, so I've had to learn to be really patient this last year, and I think y'all have been really patient as well, which I very much appreciate. So anyway, come in, front desk, check in, do all that jazz. One of the fun things we have about this office is that we have a separate phone room, and so the ultimate goal is to be not answering your phones when y'all come in here, and just have who's ever working in the phone room taking those calls, and so less distracting from from just like the interaction. So now they're still kind of pulling double duty, which we really appreciate, and hopefully we plan to move back that way. This is going to be the cat-only waiting area. And so again, no seating, but we always find it better if the cats don't have to sit and look at the dogs and vice versa. So this will be a cat-specific area, and then to the right down there is going to be for the dogs. And that'll take us through this way. This is one of our exam rooms, mine's right off the lobby. And so bigger dogs will go in there, and then we have built-in seating now. So you'll all be happy about that, because for forever you just had to stand in the corner. And so we have a nice window in here. And this one's going to be for cats and small dogs. And then this room right here, the art is also on its way. So right now it's just bare walls, but this is going to be cat-only exam room. And cats are super special. Like they're kind of finicky, so they don't like to smell the dogs, or So the ideal is just having a room for themselves. So this way. This is cat boarding, which are these little rain tree condos, is what they call them. And so we kind of have a full house today, and so. I don't know if Ralph is super happy to be on camera, but Ralph can go between the top and the bottom cage for him. Ash is pretty shy, so he will not appear on camera. And then this is Winnie. She boards here a lot, but she's a pretty fantastic cat. So anyway, she's cute. So yeah, she's one of our favorites. What you doing, huh? Okay, well, she bit me. That's okay, she's still awesome. Anyway. It was a love bite. So if we come back here, we have the break room for the employees. Again, no furniture, so we have a retro 50s table, but this is a place that they can come and have lunch and enjoy that. And so we have kind of had to fit the food in where we can, so we have all our prescription diets here, bathroom over here. Back this way through this door is laundry, and then something that we've started doing the last year has been a lot of chemotherapy. And it's not you know, not every dog is a candidate for it, or cat is a candidate for it, but some of them, some of the cancers that we run into on a daily basis are really responsive. So what we did is that we have a chemo hood that we actually have in the back in the isolated area where we'll do all of our chemo and deal with the dangerous substances there. And so eventually you'll see a 10-foot tall stack sticking out of the roof, and then when you ask yourself what that is, that's what that is. So it has to vent high for safety reasons. So anyway, it's going to be like this crazy nice building, and then all of a sudden just this smokestack looking thing, but that's what it's for. So but that's the way it has to be. Cubbies for the dogs and for our employees to keep things through their stays, because some like to come with their special stuff. This is like the general dog boarding. We're going to see both of my dogs here today. I will take them home eventually, but we'll see them and kind of show you what they get to do, or show you where they stay during the day. Hey guys, it's okay. This is Harry. He's mine. He's been on Facebook a few times for getting scoped because you need socks, right? You did. Yeah, that was true. You did. Then. Stop it. Shh. Shh. My other dog, Sasha. She's too, and then we can take out the food, put it in the bowls and things like that. So it's pretty neat. Yes, drink some more. That's good. Play with your, oh, it looks like a beaver or a squirrel. I don't know. And you have a chew bone. So that's that. Everybody's taken out 3 to 4 times a day with the staff that we have, and they're all played with. So that's good. We're expecting the splash pad to be ready around August, and so until it's ready, we're not going to use these suites, but we'll come and we'll take a look at this. This is kind of the luxury suites, and so it's kind of fun. So you'll have a camera that you're going to have access to watch your dog while they board. Cats probably can't board in here. They wouldn't like all the barking. But eventually what's going to happen is that you'll be able to watch them on the camera, and then you have a little bone handle that'll open like a little guillotine door, and that'll take them right out to the AstroTurf play yard. So I'm excited about that. We probably expect that to be done around August. But the building has to come down. You're going to start seeing that next week. So it won't take them long to get it down. It's pretty sad, but it has to go to make way. So we're excited about it, but it's also kind of sad. This is the room for the air conditions. I don't think anybody's interested. And then if we come back around this way, a good thing is, and at the last hospital, is there was minimal separation between the barking dogs and everybody else. And so there was the constant barking in our ear, and so we really had to get used to the quietness. But we have a couple of doors that keep us separated from the back, really, which is nice for y'all, and it's nice for the doctors as well. Coming around this way, one of the big focuses we had was a large treatment area and just an open space, and I'll kind of take you through it. But this right here is for hospitalized patients, or hospitalized patients that are not critical. So this little guy right here had surgery today for his eye. He's doing good. He's making biscuits and eating, so he's doing well. And it also has the ability to close the door as well. So, yay, it's exciting. And then we have the doctor's office, and I know that all the LSU fans are super pumped about this. Yep, that's right. It's good. So if we're going to build the office, we may as well make it fun. So that's my personal touch. We have Radiology back here. So we have brand new. We have a few ultrasound machines. We have a brand new one from GE, and it's a big deal. The ultrasound is like cheating. The thing is awesome. And then digital X-ray. And right here we have the hospitalized, more critical cases that the doctors can keep an eye on from the office. This is Biscuit the pug. He's doing, or she's doing a lot better, but you need to eat your food. She's doing a lot better than she was when she came in, but she's getting fluids tonight, and we'll be checking on her. This is a ICU oxygen cage, so we do have lots of dogs that come in with breathing issues, whether it's from heart failure or from, asthma, not so much, cats with asthma, fluid in the chest sometimes, just some weird stuff that we see on a regular basis. And this allows them a closed environment to get the most oxygen-rich air that they can. So that's really nice to have. This is the treatment area, and so the goal here was as open as possible. And so we can see from the doctor's office, and we can see what's going on. One of the features that we have in the clinic, which we really like, is something called an expediter system. It's not novel, plenty of offices have it, but I mean, basically it's when you step into that room, the timer starts counting, like how long you've been in that room. So every doctor is color coordinated with their lights. So we can see from our place to this, who needs to, who's been seen. If they've been waiting too long, we get anxious because we do not like y'all to wait. Sometimes it happens, but so that's really been nice for us just to see kind of where we're at in our day, especially when we're not right by the rooms anymore. We have our lab, and this is the cold laser. So it's a therapy laser, and so plenty of times we have dogs and cats who have arthritis as they get older, and so there's always the drug options, which are fantastic, and then this is something adjunct to that, right? So it's a little bit something different that that we can use, and so maybe you don't, or you're not. I mean, I think at some point most animals are going to need some kind of a narcotic, but pushing it off as long as you can is always it's a big focus. Starting to build in veterinary medicine in the last 10 to 15 years. Maybe longer than that, but so we're excited to have that. If you come in here, this is the dental suite and also the endoscopy suite, and so we have our dental table right here, and the dogs are monitored from, everything: heart rate, temperature. They have IV warmed fluids while they're having their dentals or their cohats, and so this has been really nice to have. It goes up and down, especially good for the big dogs. If you turn right here, this is our couple of our scopes, endoscopy for, my dog, for one, who has eaten socks multiple times and still continues to do them. So I don't know what you do to get a dog to stop eating things. Or digging holes, because the golden retriever that you saw on the runs is also mine, and she digs holes. And they've both been to training, so it's probably me. But they, so the fun thing about the scope, right, is that it's, it's a non-surgical option, and it lets us get places where normally you would have to go with a scalpel. And in this case, if they eat the sock, no longer is it surgery. It's just stick the scope down there, grab what you need, and that's been really nice too. It's just, I think our most interesting thing so far has been just like a ball of human hair, but anyway, that was gross. But anyway, we got it out, so that's cool. And then this is the prep area. We have a few different types of sterilizers that we use. Not everything can be run through like it's like an autoclave or whatever, but so we have two different forms to use for different things, so that's good. This is the surgery suite. So we'll be excited to have a window in here, and the monitoring equipment is, it's the best that they have right now, which Yeah, that's always something that I think when your pet goes into surgery, like we want to control every variable that we can. There's some stuff that we can't, but they have warm fluids, warming pads. You see the laser here in the corner. So another fun thing, and it's everything's been back ordered, but one of the fun things that we have is that we're starting to do laparoscopic surgery. And one of the big things is going to be laparoscopic spays, right? So, I mean, you know, there's nothing wrong with spaying a dog like the regular way at all. And we've been doing it like that for forever. But now we have a new tool. So you're talking about 2 little holes, one for the scope, one for the operating channel. We take out just the ovary, and these dogs, you know, like they go home with no sutures, just like a layer of glue in the skin, and then like these dogs are chomping at the bit the next day, ready to get back at it. Whereas now the typical recovery time for a spay, 3 to 4 days. There's a lot of abdominal soreness from that incision, and so it's about, you know, research has been proving it at about 65% less painful, faster recovery, and no cone, right? So I think that, you know, it's funny because a lot of surgeries, it's terrible, and then, you know, like you've just been through this big dramatic thing, and then you're like, and then they have to wear a cone, and people are like, no, not gonna do it. So everybody hates the cone. So at least with that procedure, no cone. So we're super excited about that. So if you come through here, we step into the lab and the pharmacy area. Everything is labeled. The girls have been doing a great job with the label maker, so we know where everything is. And look down here, we've got just the lab area, and then eye washing station, which you have to have that just in case. I've needed it a few times. It's mostly anal gland related, but whatever. It's been bad. So this is the in-house lab that we have. We do send out a fair amount of blood work, but I mean, most of the time, like when your animal's sick, like you want to know right now. So that's what this allows us to do, which is really good. We're super lucky to have it. This room down here, see, we still have like little things in the doors, like this is what we need for the rooms. This is kind of like the consultation and the sympathy room. So it's a sad room, but or it could be happy. But we have a fold-out table that comes down, and so, you know, when it's that end-of-life situation or, you know, a serious conversation, we're gonna have a couch here. And then the nice thing is you'll be able to leave out this door, or we can do some stuff outside through that one. So this is about the basic layout of the rooms. I'll take you through one more so you can see. And then this is the exam rooms, a lot bigger than the older building, less cramped. Don't feel as on top of each other. Built-in seating, which is fun. So excited about that too. And we do have a scale in the front that you can weigh your dog on whenever you come in. Again, that's not a cat thing. I mean, you could, but for some wonky reason, dogs just don't like to get on top of scales. So we have 4 rooms that have lift tables with scales on them, so it just makes it easier for y'all. And the dog's more comfortable as well. Perhaps the sassiest room in the clinic is the bathroom. So the designer did a great job with this one. It's just kind of fun, you know. And then if you look at it at different angles, you maybe can't tell, but you'll see the like they have the bones, the skeletons of the animals in there. So it's kind of fun. We also have a urinal in here, which that was something to do with the tower. But anyway, I don't ask questions. I'm just like, okay, I get that's how it has to be. Coming around here, you come back into the lobby, and so we're gonna have, I just strictly have not gotten along to getting the Keurig. I think if I get an espresso machine, that's like pretty over the top. So we'll probably just have coffee here, and then plenty of water in the fridge for everybody. place to drop trash. So water fountains, which I also didn't know you had to have, but you have to have them. So that's available. I think they've kind of fallen out of favor in COVID, but what do I know? But that's it. You know, I mean, that's the place. Going from, let's see, yeah. So just a few talking points. The previous place was about 3,000 square feet. We've gone to 8,100, and then same staff, same people. You know, like nothing has changed. Well, you know, slowly it's trying to find the right fit for the people that come in here. So trying to make sure they fit our core values that we have posted up in the manager's door. I didn't show you that, but because that's her office. And then there's nothing. It's just a bigger spot, right? We can do more stuff. I mean, it's more comfortable for you, but still the interaction that happens between myself and any other vets across the exam table is going to be the same. So it's the same great care, and you know, those of y'all that may see me, you know that I'm pretty goofy. But anyway, so I mean, we like to have fun here, as Maggie Placer, one of our associates, would say. But you know, we're excited so to share it with y'all. And yes, so the grand opening is tentatively, probably definitely going to be July 23rd. It's going to be 5:30 to 8:30. We're going to have a fun jump. We'll have food. I think there might be alcohol involved, but I mean, you know, not liberal use of it. But so anyway, we're excited about that, and then you're welcome to come, and we'll be here to show you around for sure. We'll all be in town for that one. My dad's going to be in town, so that's good. I'm sure he'll like it as well. And then just if you have questions or comments, like leave them at the bottom. This is my first Facebook Live deal, so they will get relayed to me at some point. But I mean, that's basically about it. But yeah, we're super excited. It's not done yet, but we're in, and you don't have to park at the car wash anymore, which, you know, like some people, I mean, I don't know. It was getting tiring running between the building and the car wash. But if you still want curbside service, you can have that too. So if you just want to still stay in your car, that's no problem. But we'll settle back into some normalcy August, September, I think. And I mean, I hope everybody stays safe this weekend with the weather. But we're looking forward to seeing y'all come through the doors and just say hello and welcome to the place. So thank y'all.